Welcome back. Well, there's a critical shortage of medical specialists in the country, and Wits University says it's looking to change that through its new surgical skills lab. The 22 million rand lab, which was officially opened yesterday, will help to enhance the training of surgeons across disciplines in a state-of-the-art environment. For more on this, I'm joined now by Wits University's Head of Department of Surgery, and that's Professor Martin Smith. Prof, good afternoon. Thank you for joining me. So this lab, how does it fit in with trying to respond to a need that you identified as an institution?
Thank you, and thank you very much for highlighting this very exciting innovation. So let me begin by saying that the unmet need for surgical care across South Africa and particularly low-income countries is a significant humanitarian crisis. And to address that, we need to do a number of things, including strengthen our district and regional hospitals. But what this offers us an opportunity to do is to really impact on the quality of the human resources that are needed to provide that kind of surgical care in the country. So this laboratory, this skills lab and skills environment offers us an opportunity to do significant training in a standardized and in a managed way, using modern technology, using modern information technology and modern technology to ensure that the training of the next generation of surgeons will be appropriate for the work that they're expected to do. So it's about dealing with the human resource component that I think we are intervening with at the moment, which is really a responsibility of the university to train the next generation of surgical care providers.
So will it cater for multidisciplinary streams of specialists to be able to come through and do the training?
Yes, certainly. So I think that in surgical care, there's a number of generic competencies that will be appropriate to whichever discipline is providing the surgery. And then this offers us an opportunity really then to highlight those specifics for each discipline. So disciplines of orthopedics, neurosurgery, ear, nose and throat surgery will all have an opportunity to join in this endeavor and to contribute and to ensure that their trainees take full advantage of this. It's a very versatile environment, and so we can use it for in a number of different ways. And so that gives us that opportunity. We're also able to train undergraduate students, graduating doctors, in also basic surgical skills. So it's really a comprehensive environment.
Are you also hoping that with time it will establish itself as the center of excellence for people to actually access some of these surgeries and some of these procedures conducted by some of the specialists who will be undergoing their training there?
So we have a long history of skills training in our university and in our department. And what this does is it allows us to take it to the next level. So what we've done now is we've introduced new technologies, new methods of training. So yes, it will allow us to take it and become a center of excellence. We're not the only center of excellence, but certainly being the newest, we have an opportunity to use what's been either provided by the university or by donors. And so I think that the donors recognize, and often they are from the biomedical industry, and so they recognize that their contribution to training the next generation can also be expressed through this environment. So I think it's from that point of view, everyone will be able to ensure that their vision for the improved training and skills in the country will be made possible.
Yeah, but Prof, I guess I'm asking that, will it be accessible by ordinary South Africans, perhaps needing some kind of surgery that happens to be part of the areas in which you do the training? I guess that's where I was going with Center of Excellence.
Okay.
Let me say at least Center of Access for the public.
So the university doesn't work in isolation. We work together with the national and provincial departments of health. And so we do our actual training and our service delivery, and some of our research happens on the public hospital and some private hospital platform. And so what we're doing here is we're preparing to ensure that people have the kind of skills when they go and treat patients, that their skills are appropriate and up to date and advanced, so that we're providing safe and high quality surgery. So this unit doesn't actually provide an opportunity to operate on patients. This prepares people to operate on patients on the historical platform in which we provide service to the.
Makes sense. Prof, just help us make sense of, what's the need out there? Earlier on in this conversation, you used the words a significant humanitarian crisis, talking about, where there's a shortage of these critical skills, specifically narrowing it down to the surgery-related fields of expertise. What is the most critical need, and where is the one discipline that really keeps you awake at night that South Africa needs more of at this current moment?
So since 2015, there's been significant research published globally around the unmet need of surgical care. And so globally, because we don't have numbers specific for South Africa at this point in time, but globally, it's recognized that of the 7 billion people on this planet, 5 billion do not have access to surgical care or appropriate surgical care. And in addition, we've recognized that about 143 million extra surgical procedures need to be performed yearly to achieve adequate access. So while South Africa has better access to surgical care compared to other sub-Saharan countries and other and low-income countries, the problem is that we don't always have the highest quality of surgical care. And so to improve that quality of surgical care, we need to strengthen our district and our regional hospitals. And to do that, amongst other things, we need to strengthen the human resources. And I think what we're doing here is trying to make a significant contribution to strengthening the human resources at many cadres. It's not just the specialist surgeon. It's also at the level of a medical officer. It's also possibly even at the level of a clinical associate. So there are many levels that we can intervene to try and improve the skills of those delivering surgical care. So it's a comprehensive problem. The humanitarian crisis is not only because of skills shortage, it's also because of infrastructure, equipment, and other such issues. And so we need to have a comprehensive plan to address that.
Yeah, and you've outlined it quite well, Prof. Thank you for that. That's Professor Martin Smith there from the University of the Witwatersrand telling us about this advanced surgical skills laboratory that they have launched at the institution.